much.
Did you know that Brazilian butt lifts are deadlier than open heart surgeries? Joining us to discuss safety concerns in plastic surgery is Ocean Drive Plastic Surgery's founder and dual board certified plastic surgeon, Dr. Alan Durkin. Welcome to the show. Welcome to the show, Dr. Alan Durkin.
Thank you so much.
Absolutely. So how can patients ensure plastic surgery is safe?
So the first step is to find a board-certified plastic and reconstructive surgeon. You want to find someone that's gone through the American Board of Plastic Surgery training program, and that's an active member of the American Society of Plastic Surgeons. Once you find that person, that male or female surgeon, then you have somebody that you know has dedicated their career towards safety and elevated patient outcomes. The next step is you want to evaluate what are their passions. If you're looking for a facial procedure, you want to find somebody that lives and breathes facial surgery. If you're looking for a breast augmentation outcome, you're going to want to look for somebody who's doing a large volume of breast augmentation. Not necessarily the most expensive, but somebody who's doing a good volume of that. And then once you find someone that you've aligned their passions for clinical outcomes with your desires, if you're looking for a facelift, you want to find a face guy. Then you want to deep dive into that specific practitioner. You want to ask themselves, beyond all the sizzle, you want to look for the steak. Are they doing peer-reviewed literature? Are they training their other colleagues? Are they available to their other colleagues? Are they affiliated with a major hospital system? These are all markers of physicians that are going above and beyond what is required of them. At our practice, I'm thrilled to, we're really a face and complex breast practice. That's what we do the most of. We perennially and routinely publish on both issues. We're also active at the chairman of the Division of Plastic Surgery at Cleveland Clinic, Indian River Hospital. That's a sign that my peers think that I do a good job and that they've put me in charge of the division. Those are all signs to patients that these people are taking their jobs incredibly seriously. And then when you take all of that, then you actually have to go and meet this person. These days, there's good technology as well. You can do it online, but you have to have a conversation with them. You have to make sure that you can communicate effectively with them. The patient-physician relationship is paramount and mission critical to success in every aesthetic procedure. And that just starts with just frank, open communication. These issues for our patients tend to be very intimate. They have to be treated as such. And patients have to know that when they're saying something to us, we're listening to understand, not just listening to reply. That is the cornerstone of your relationship, and that's going to be the greatest driver of success downstream.
What are some other trends in plastic surgery?
So this is an absolutely exciting time to be involved in plastic surgery, specifically in aesthetics, because of the GLP-1 inhibitors. So that's semaglutide and tirzepatide, also known as Ozempic and Wegovy. There are hundreds of thousands of Americans right this minute that are losing weight that they thought they could not lose, and it's being shed from everywhere. So the most common thing that you were hearing about is something called Ozempic face. We're seeing an absolute litany of those patients because we're really a facial center. And we've been drawing people from all over the country for years. But now with Ozempic, there is a huge influx of men and women that are on this fantastic wellness journey. And for the first time in decades, they're hitting their goals. But as they get closer to their goal, their journey changes a little bit because their aesthetics change and they have accelerated fall. So we're seeing really good opportunities to combine aesthetic medicine and plastic surgery and really elevate these patients' skin quality and then undertake subtractive procedures, elevating procedures like facelift, high-intensity microfocused ultrasound, something called therapy, specific bioinductive fillers, high-grade skincare, laser therapy. Combining all of those modalities, we can bring patients' faces and their bodies back after massive weight loss with remarkable results. I think the secret to those patients, though, is really the mixture between medicine and surgery.
I completely agree with you. Now, what types of advanced training do you offer medical professionals?
So we are lucky. We started a training center in 2017 called MedSpa Network. Our goal was to do two things. One, we wanted to give access to physicians entering aesthetics that don't have formal aesthetic training. These are good physicians, and they're leaving the hospital system, and they're getting into arguably the most exciting component of American medicine. They're good people. They deserve the opportunity to be trained. One of the things we love to do is use our techniques both inside and outside the operating room to show them the aging process and show them how to counteract it both surgically and non-surgically. We started that in 2017, and I am proud to say we've trained over 4,000 injectors throughout the United States, both physician and nurse injectors. I've also had the absolute privilege to train over 200 plastic surgeons on my specific facelift technique, which is really one of the greatest accolades I've ever had in my not so long career. That's MedSpa Network. We're incredibly proud of that, and our first foray internationally is next week. We're going to Asia, so I'll let you know how it goes.
Now, where can we go for more information?
For Ocean Drive, we're oceandriveplasticsurgery.com, oceandrivedermatology.com, oceandrivemedspa.com.
Thank you, Dr. Alan Durkin. It was great having you on ISF and sharing everything we need to know about plastic surgery. Stay with us. More Inside South Florida when we come back.